Okay. All right. Call the meeting to order of the Dubuque County Board of Supervisors, Monday, May 11th, 2020, 9 a.m. At this time, would ask everyone to rise, remove your caps for the Pledge of Allegiance. You can see the flag through my camera. I'll get my chair out of the way. I pledge allegiance to the flag of the United
States of America,
and to the
republic for which it stands,
one nation,
under God, indivisible,
with liberty and justice
with
for all.
liberty and justice for all.
Thank you. Okay, at this time, we're under public comments. Anyone may address the board on matters which are on the agenda. Please go to the podium, which is not applicable today, of course, and state your name and home address. If there's anyone on that wants to speak in public comments, they can raise your hand on Zoom, and Dawn will unmute you, and I'll give an appropriate amount of time to see if there's anyone to speak. Okay, we'll move forward with the agenda. Proclamations, don't believe we have any today. So we'll go to item number 2, approval of minutes of meetings of April 27, 29, May 4th, and May 6th of 2020.
Supervisor Baker, this is Ed Raber.
Hi, Ed.
Good morning. I would like to ask you to table these to your Wednesday meeting. There's some information from the public hearing that you held on the CDBG that is not present in the quantity that it really needs to be for approval of that. So I'd like you to ask the Board of Supervisors respectfully to table the approval of the minutes until Wednesday, and we will add some additional information there about that public hearing.
Ed,
and you'll be preparing that yourself, right? Ed, you will be preparing the information that needs to be recorded in the minutes?
I can. I think it's probably just a bit of a snafu as I work through this with Mary to make sure that that's there, and I'd be happy to do that. That'd be just fine.
And Ed, I have a question. Was that at all 4 meetings or one particular meeting?
No, that was just at May 4th.
All right, I would ask for approval for the April 27 and 29 meetings and the May 6 meeting, and that we table action on the May 4th meeting, if that makes sense. That's assuming that the other minutes are acceptable.
Excuse me, Dave?
Yes.
The minutes, because this is Mary Havel, because the minutes are, you recess between your special meetings that you have, the set of minutes, it's not like for 4 different sets of minutes. All the minutes are one.
Okay.
It's one set of minutes because of the special meetings. It's one set of minutes for all 4 meetings, not 4 sets. So you can't approve just part of it.
All right. Thank you for that.
Thank you, Mary.
Then I would suggest
sounds like then I'll make a motion to table the approval of minutes from the 4 published 27th, 29th, May 4th, and May 6th. Motion to table those approval.
I'll second that, but in discussion, I want to ask Mary if we're still okay for any other timelines that we have for publication for the minutes.
Oh, no, you just publish them once they're approved. So there is no timeline for that.
Okay, any other questions? Motion was made and seconded to table the minutes. All in favor signify by saying aye.
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 Carried 3-0. Okay.
Thank you.
Consent items, I don't see any. Item 4, procurement procedures, proof of publication.
I'll make a motion to approve the proof of publication.
Excuse me, there
I will
isn't a proof of publication because we don't have any procurement. We only have a request for quotes this time. So that
Thank
is
you,
to
Mary.
put the ad in the paper, so there is no proof of publication.
Thank you, Mary.
Thank you. All right. We'll go to request for quotes, fuel for secondary roads.
I'll make a request to approve the request for quotes.
Okay.
I will second that.
Motion made and seconded to approve the request for quotes, fuel for secondary roads. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. Okay, item number 5 is public hearings. Proof of publication for public hearing.
Again, there
I
is
don't see
no
that either.
proof of publication. No, because we don't have a public hearing today.
So there's no proof of publication? Okay.
No, there isn't.
We'll go to 5B, notice of public hearing. FY20 budget amendment number 5. This is the notice of public hearing.
Good morning, everyone. This is Stella. Can you hear me?
Yes.
Yes, go ahead, Stella.
Yes.
Great.
Good morning.
So in your packet, you'll see the notice of public hearing for our final budget amendment of FY20. We have to amend our budget by the end of May, as you're not allowed to amend your budget in the last 30 days of the year, which would be our month of June. So this will carry us out through the end of our fiscal year ending June 30th. The public hearing is set to be May 26, 2020. So that's a Tuesday meeting, as that Monday is a holiday, at 5:30 p.m. in the board chambers or on Zoom. There isn't a ton actually in this amendment, but I'll kind of walk through what we've put in here. Several things have happened just over the course of the last month to add to this amendment. First, you increased your contribution to the Community Foundation. There were a couple of grants received by a couple departments. The Auditor's Office got a Vote Safe Iowa grant in the amount of about $10,000, and that is for cleaning supplies and cleaning on Election Day. The Sheriff's Department received a DOJ coronavirus grant, $58,000 and $58,008. So there's new revenues and expenditures for them for that. Anthony increased his bridges and HMA projects a little bit to hope to get a jump on those in this fiscal year. One that I think we haven't really talked about a whole lot, but I saw when I was going through all the budget departments was that the medical examiners department, I did increase payroll and medical and health services and mileage in that department. They are getting called out for many more autopsies right now related to COVID. And so we're close to hitting the numbers on those budgets. So I added some to give a cushion there as to not go over. For the DHS department, we did the phone system, which we've talked about at a couple of work sessions. Let's see. Also, general assistance, there was an increased burial expenditure, which we talked about at our last meeting. Rickardsville, the loan that we did to them, has been added, as well as the ECIA emergency loan fund that you approved at the last meeting. In our risk management area, we finally finished up our lightning strike claim back from the fall, so I decreased those to actual expenditures. And the Dean FEMA project, there was a new appraised value, so I had to increase the budget to the new appraised value, so the revenue and the expenditure. So there's actually not a ton in this amendment, and of course, this is the form that the state requires. So you can see that it breaks it down into different buckets than we typically look at in our departments, but there's the intergovernmental revenues. Those are going to be grants. Miscellaneous income, part of that is going to be like the decrease in the lightning strike came in less than what we had budgeted in total. So there's some decreases there. Sorry, my form on the screen is a little small. Let's see. And of course, then you walk down our revenues total at line 17 in the third column. So total proposed revenue budget of $62,726,477. And then the increase or the changes in the expenditures as you walk down. And those are the things that I just mentioned. Each department, there's multiple departments housed in each one of those lines. So we get down to total expenditures on line 31 of $82,480,556. And then it walks through our fund balances. So I also put our fund balances, if we can flip to that worksheet maybe, to show our fund balances. Dawn, can you flip to the next page? As we're working on that, I'll just keep going. Our fund balances, it should be in your packet, so you should be able to access that. There are FY19 actual fund balances, and then it has our current FY20 budget and then our proposed amendment. So in this amendment, it was an additional approximately $700,000 in expenses. So it's decreasing our fund balances down in total to about $30 million. And you can see it walks through each one, general, basic, general up. We still have very healthy fund balances. We've been monitoring, the effects of COVID and what we think is going to happen here. We've been doing some modeling. So we're still in a very healthy position. Anthony and I have had some discussions. I heard you talking about it this morning about local option sales tax and road use tax. And we're watching that and fully aware that there's going to be some decreases in there, and we'll be adjusting as needed. The big changes in our revenues do affect Anthony and Roads Department. So we're still in very healthy position as we move forward out of FY20 into our FY21 budget. Things are still looking really good for us. I did submit some stuff to ISAC on our COVID revenues and expenditures, and then was asked to submit more because they're going to use it for a case study with the White House. So I will get that information out to all of you of what I submitted of our increased expenditures and lost revenues to date.
Thank you. I'd appreciate seeing that, Stella.
Yep.
Any questions for Stella? Any additional questions?
Not at this time.
Okay. All right, thank you, Stella.
So what this document is that you would be approving today is to set the public hearing for May 26th on the budget.
May 26th at 5:30 p.m. I'll point out that that's a Tuesday, which is necessary because of the Memorial Day holiday.
Yeah.
I'll make a motion to approve the notice of public hearing for the amendment for the fiscal year 20 budget set for May 26th at 5:30.
Second.
Okay. Any additional discussion? All in favor signify by saying aye.
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 Carried 3-0.
Thanks, everyone.
Thank you, Stella.
Okay, item number 6, approval of plats. I don't believe we have any. Item 7, action items. The board may approve, deny, or table any action item. I'm sorry? No, okay. We'll go to 7B. A resolution approving 2019 Iowa Certified Local Government Annual Report submitted by the Dubuque County Historic Commission.
Chair, I have some questions, if I might.
Of course.
Dawn, I don't know if it was submitted to you or when this was submitted. I don't know when. It looks like they've missed the deadline for submitting this to the state of Iowa. Is anybody here today before us to, probably not because it's an action item. I have multiple questions about the document that I received Friday night in terms of the actual report. I'm hoping you can give some context for where this came from and, just kind of a status, if anyone can provide that.
And this is Dawn. I received this from the Historic Commission prepares this, and this was specifically forwarded to me from RRS. And she's a member of that commission. So
she chairs the commission.
Yeah, she had acknowledged in the email that it was late. She had mentioned due to the COVID situation, but I do not see her available on Zoom or that any place that I can indicate that's her for any questions.
Okay. So then, again, I guess to my colleagues, this is a report from 2019, calendar year end ending 2019. I'm not aware that these meetings are stated, but I don't know that they were open to the public. I had asked this commission to send me notices of when they were holding meetings and have never received that. So I'm just not sure. I think I appreciate all the work that this commission does. They are a commission of 7. They have historically had at least 3 vacancies and still maintain 3 vacancies. So it's, I think, a commission that could use some structuring and some assistance. I just have various questions about the answers that are in the report. So, I'm going to make a motion to table until we have time to have a work session with the committee.
I will second that. Open it for discussion.
Well, this is Supervisor Wickmore. I understand, wanting accuracy and stuff. I think we should look at priorities of our roles and the roles of the community. And right now, based upon what we're facing, a 2019 report of Dubuque County Historical Commission is not of importance. So I would advise my colleagues not to spend too much time on this.
This is Ed Raber. If you, I'm just jumping in here. I'm aware of what certified local governments do and things, and I'm familiar with the person that submitted the report. I don't have that history there, so Supervisor McDonough, I guess I didn't get any of that background prior to now. I'd be happy to reach out to her and try to schedule in the very near future a work session. And I'm sure that my anticipation is that she would be happy to come in and talk with the board, go through some things and try to, I'm not sure that they've been meeting in the last 6 weeks, maybe they have, but see if we can get 2020 off on the right foot for the rest of the calendar year.
Would this
Thank
be,
you, Ed. I would appreciate it if you would do that. That would be helpful.
Yes.
and I did,
I would not be interested in that work session.
I was gonna suggest, and I did read the report, I'm assuming this is the one that was delivered to my house, Dawn, is that correct? This was delivered to my house, and I, turned it over to staff to process it. I did read it thoroughly, and I'm comfortable with it, but I think I'll support the motion to table, but I would suggest to speed things up that Ann get with Ed and RRS for a meeting and then report back to the full board. I really don't have any interest in convening a work session on this. I didn't notice any specific requests from them, so I would say I'll support the motion to table. We'll find out, Ann, you can get your questions answered, and then we'll bring it back if that's acceptable. So, and that should speed up the process. So, all right, the motion was to table this resolution. Is there any other discussion? All in favor signify by saying aye.
Aye.
Aye. Any opposed?
Nay.
Carried 2-1 to table. Okay, 7C, resolution, approve the temporary delayed travel restrictions of county roads on June 28th, 2020 for the 2020 Park Farm Wine Run 5K. Is Anthony still on? I know he was.
Yes, I'm on.
Anthony, any words of wisdom on this? Is this a recurring event?
I don't know if this has been done.
Yeah.
I think this might be a new event. It's on a pretty remote stretch of the, Dubuque County roads. It's, it's pretty quiet road up there. I guess the sheriff's department and myself, really, we don't have, many issues with it. Of course, we're not sure where we're going to be with this virus pandemic, so that would be the question mark right now.
What decision making do you think we have over this with regard to COVID? If we don't want to have a gathering on June 28th of this year, what do you think what could we do about this if we approve it now?
Yeah, I don't know what
Well, the governor, we've yielded our powers to the governor a month or two ago, and so the governor will dictate how large gatherings and events like this are able to proceed.
But we have the authority to approve this or not, correct?
The road issue, but not the gathering.
But the road closure, we get to approve that.
Agreed, but they still could gather on private property if the governor would
Sure.
approve it.
They could do that anytime, COVID or not. They could gather
Not true. Not true.
The purpose of them coming before us is because they're seeking road closure, and I do think we have the ability to decide whether or not we want the road closed for this purpose. And I guess
I'll make a motion to approve the resolution.
There's a motion to approve the resolution. Is there a second? I will second it. Open for discussion.
What do we intend to do if we feel our numbers in our county would not allow this to be a safe road closure for purpose of this gathering? Are we going to have opportunity to have this come back to us? Or are we making this decision now for this event in late June?
think we're,
The governor's proclamations will stand and will override our road issue related to this gathering.
So Jay, are you ceding our ability to decide a road issue to the governor?
The proclamation that the governor's issued would not allow this today, if her proclamations would continue to stand. Now they're set to expire on the 15th of this month, and we shall see what occurs at that date.
So we could have this come back to us at another time to see whether we want to support this or not. Certainly it's a fluid situation. It changes every day.
Agreed. I just don't think there's any downfall in approving it. And if the governor would lift the bans, you'd have this completed. And if you wanted to revisit it, you certainly would have that option. But tabling multiple things doesn't necessarily help us become more efficient.
any other discussion? My opinion is we're approving that if they have this event, if it's legal for them to have it under the governor's proclamation, whatever rules she has in effect at that time, that we're making sure that the roads are closed and or monitored for safety purposes during the race.
Right. Chair Baker, Sheriff Kennedy is in the chat box saying that the Run for the Troops was originally scheduled for the same weekend, and that's already been canceled, just to put that into our frame of reference as well. Now, they chose to do that themselves, but I'm not sure we should just let this go away, that this is maybe a minor thing that we have to control gatherings, despite whatever the governor is going to choose to do on May 15th.
Okay, I have the Zoom up on my screen. Do we have a document? My understanding is these things have to be signed off by the appropriate elected officials or department heads. So I guess I want to know, did Sheriff Kennedy sign off on this, and did Anthony Bargett sign off on this?
Yes, this is Anthony. I did sign off on it.
Okay. Is Sheriff Kennedy on the call?
Do you have the document, Don, to put up? The signatures are contained on that.
Sheriff Kennedy signed it on the 9th of April.
If one of those two rescind or say they're not supporting it, then that might change my opinion. Okay, I'm not hearing anything.
And understand
so.
all I'm asking is, how can we get this back if we feel that there's a resurgence or a spike, if we are uncomfortable about authorizing, even though it's just a road closure, authorizing a road closure for a run?
The answer to that would be you just request it. So you just request this to come in front of the board, and we'd have comment and discussion on it. Put it on the agenda at any meeting.
Anthony, does it have to be done a certain number of days before the race? Could this come back to us? Could it be on them to bring it back to us?
Well, just trying to think through the process here. So if you approve it, it'd be on us to really, bring it back up again and disapprove it or unapprove it, whatever you say. I don't think it's on them to bring it back to us, I guess.
I think the issue is going to be whether or not the governor allows this. If it doesn't fit that criteria, then they would be in violation of the governor's order, which would be an enforcement issue at that point. But probably would be plenty of time to contact them and let them know that even though we approved this based on our belief that, it would be okay to do so, on June 28th. If that isn't the case, then, they wouldn't be able to have it unless they have it on, they wouldn't even be able to have it on private property.
Right.
So,
This application is from
Yeah,
a
this
person
is not a new
in
thing. This is not a new thing. We've had multiple closures of multiple events. So people in the general public and the private sector, along with government, are unfortunately very familiar with canceling events based upon the change of circumstances. So it doesn't seem very difficult or hard to understand based upon what we've gone through in the last 60 days.
There's a chat comment from Tom Jordan. He says he is the race director, and indicating that if we have any concerns in June, he would gladly cancel the event. And if we're nervous about the event in June, our participants would also be, so we would not want to host the event. So based upon that, I'm going to deny the request. That will be my vote, and we can push that to these folks to come back in June when we all know better what's going to happen. I'm not interested in doing anything to allow something that I have discretion over. It's completely trivial. It's a fun run.
okay, any other discussion? All right, the motion, as I understand it, was to approve the resolution. Any further discussion? All in favor?
Yes.
Go ahead.
No, I said I was confirming that was my motion.
Okay.
To approve the resolution as presented.
All in favor signify by saying aye.
Aye.
Aye. Any opposed?
Nay.
Carried 2-1. Okay, item D, resolution, approve necessary documents with Farner Asphalt Sealers LLC for furnish and apply pavement marking paint for the Dubuque County Secondary Road Department. Anthony, you have any comments on this?
No, everything looks good. Farner does a good job with pavement marking, so I would recommend it.
Motion to approve the resolution.
And I will second that.
Motion made and seconded to approve the resolution. All in favor signify by saying aye.
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 Aye, carried 3-0. Item E, resolution, approve necessary documents with Bard Materials and River City Stone for the supply and deliver maintenance rock for the Dubuque County Secondary Road Department. And again, Anthony Bargett, if you have any comments.
No, everything looks good.
I will make a motion to approve the resolution.
Second.
Motion made and seconded to approve the resolution. All in favor signify by saying aye.
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 Aye, carried 3-0. Item F, resolution. Approve necessary documents with Top Grade Excavating Incorporated for the HMA resurfacing, culvert replacements, and grading on Lake Eleanor Road, Old Castle Road, and Ridgeview Drive. Project LOST-2101-73-31. And again, Anthony, any issues with this? Comments?
Nope, looks good. I would recommend it. And we're obviously getting very used to Top Grade this year, so and they do a great job.
Okay, what's your pleasure?
I'll make a motion to approve the resolution.
Second.
Okay, motion made and seconded to approve the resolution. All in favor signify by saying aye.
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 Aye, carried 3-0. Item G, resolution approving the contract for services with ECIA for the Dubuque County Emergency Loan Fund. And I don't know if
Motion
Ed,
to approve?
okay, there's a motion to approve. Is there a second? I will second it. Ed Raber, I don't know if you have any comments or words of wisdom on this particular item?
Words of wisdom, I'll withhold whether that's what they are. I appreciate, we worked the end of last week with Matt Specht from ECIA on a couple of editing items. I also appreciate Stella, and I think Denise Dolan had some comments too, just to kind of work out some of the mechanics of how money flows and when it gets paid back, some things that I would not have been aware of. So I appreciate their providing that guidance. And the document, I think, that's in the packet today meets the guidelines of what Stella wanted to see, and as well as Matt from ECIA. He was anticipating being on the call in just a little bit. You guys are rolling along, so he normally would be here, but he is not. So if you have any specific questions, let me know. Otherwise, I think, as I had noted in some communication to you, I'm ready to, after this meeting here, I'll be sending out a press or a media release about that. And we've been working with our partners to make sure that this is operational just as soon as possible.
Right. This came back just for some minor modifications
Yes.
of some language that Stella and Denise had asked us to include at our last meeting. So that's the purpose for my motion to approve. I think we're ready to move forward.
Any other discussion? All in favor of the motion to approve the resolution, signify by saying aye.
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 Aye. Carried 3-0. Next up is item 7H.
Thank you.
Resolution approving West Campus change order number 5 for lighting and digital signage. Again, Anthony, I guess we'll go back to you and possibly Nathan Gilmore and or Chris Soder.
I'm here, Dave. Was there a question?
Just, I just want to know if there's any comments.
My question would be maybe, I guess I would have a question. I think the resolution says 30,000 and the contract and the documents at 37,000. Can somebody explain the difference?
I believe FEH is on the call. Yep, there's Christy.
Yeah, Christy Monk here with FEH. I can explain that, Jay. Gary was going back over the spreadsheets and the pricing, and we discovered that there was a credit that we had not received from Portson. So we do have a $6,500 credit for some painting that was part of the bid but wasn't included as part of the project. So we applied that to this document. And you can see it's scanned very nice and straight here on this document on the screen. But we have the site lighting and digital sign cost of $37,383, and then we have a credit of $6,500 for the painting.
Okay, thank you, Christy.
Yep.
Any other questions?
Being a Dubuque girl, Christy, I love to see those discounts and the coupons and the rebates back. That makes it so much, it's always fun to see those. And I appreciate you keeping those good records.
I gotta give Gary the credit on that.
I'll make a motion to approve the resolution.
I think we already had that, or am I incorrect? No, okay. There's a motion to approve the resolution. I will second it. Any further discussion? All in favor signify by saying aye.
Further my comment, I think, my comment, so yeah, just a comment, I think it's the digital sign and the cost for the digital sign just doesn't line up for my appetite today as far as the value that it would provide. I think the lighting is important and can help people direct to the correct access and driveway, but the digital sign, I just don't think it's going to provide a lot of value, so I'll be voting no.
Okay. Any other discussion? All in favor of the motion signify by saying aye.
Aye.
Aye. Any opposed?
Nay.
Carried 2-1. Okay, we'll move on to item 8, communications. Correspondence that the board will receive and file without taking action. Item A, amendments to zoning ordinance, hatch maps, Koss, Sporl, and Renaker.
Motion to receive and file the amendments to zoning hatch maps.
Okay, so motion
And I will second that.
made and seconded to receive and file. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. 8B, City of Piasta annexation notice.
I'll make a motion to receive and file the communication.
Thank you. Second.
Motion made and seconded to receive and file. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Okay, item C, letter from Dyersville regarding urban renewal plan changes.
Motion to receive and file correspondence.
And I will second that.
Okay, motion made and seconded to receive and file. All in favor signify by saying aye.
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 Aye, carried 3-0. Item D, letter from Rickardsville regarding a voluntary annexation.
Motion to receive and file the correspondence.
And I will second that.
Okay, motion made and seconded to receive and file. Any discussion? All in favor signify by saying aye.
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 Carried 3-0. We have no appointments or vacancies today, so we'll skip over number 9. Number 10, personnel requisitions, permanent full-time clerk for county attorney. Dawn Sherman, our HR director, can comment on this.
Thank you, Chair. This one is due to retirement, but this does have a budget impact. Currently, he has several part-time clerks, and earlier this year, one of his clerks had a reduction of hours. She reduced her hours, I believe, from 29 to about 20. So he continues to have some salary savings there, but as this retirement came upon him and he was evaluating working with his staff of the best kind of flow of operations, he is requesting that you replace a part-time clerk 4 with a full-time clerk 4. So there's about $6,300 in salary savings because the current employee is at the top of the scale, but you would incur some benefit cost if the new employee were to take the insurance cost or take the health insurance. So, and that's about $19,000. So it does have an impact for budget for, and really it'd be for the next fiscal year. And CJ is on, I believe, as well, or Zoom.
Yes, I'm here.
Yeah, CJ, it looks to me like we're doing two things. We're increasing the hours of the position, but it looks like we're also increasing the pay classification, if I'm reading it right. Because I'm reading it as
Right, Dave.
part-time clerk 3 and transitioning to a full-time clerk 4. Normally, there has to be some kind of a reason to do that. And normally, these are done if somebody's performing over the level of a clerk 3, for example, but we wouldn't be able to tell that at this point. Can you explain the rationale?
Absolutely, absolutely. So we currently have within the support staff, there are three part-time positions. And this spot that's opening up is due to a retirement from Ms. Dolphin. So she is the only clerk 3 in the office. The other 2 part-timers are clerk 4s, also as our every other support staff. My understanding kind of historically is that the part-time positions, the 3 of them kind of came about adding extra help, then adding extra help, but not being such a great increase because of the benefit cost. So my kind of long-term plan with this would be, as the other 2 part-timers may retire, that we would take even one of those and make those one position. But the problem with the part-time, really from a logistic standpoint, is that they're only here obviously certain days of the week, and then they leave, of course, and then they might miss like Thursday, Friday, and then Monday of one week, and then they come back in on Tuesday. And so for their workflow kind of starts and stops, but in the meantime, what we're doing keeps moving, notifications and things like that. So it's really kind of hard for them to be part of the effective flow of the work since they're missing days in between. And I hope that makes sense. When she's been actually gone for some time, her husband has some health issues, and gosh, he's been gone since before we started the reduction of hours and work and all that back on the 23rd of March. So, and then somewhere along the way, she gave us her notice that, and she was planning on retiring. She had just not made an exact date, but she's done that now. So in moving forward, I mean, one thing that we're doing some things that we haven't necessarily done in the past at the request of the attorney staff. We now have direct access to many things that, in the law enforcement center and through law enforcement that we in the past needed to rely upon them to get to us. So that's sort of shifted some of the workload naturally back here into the office, because while it's worthwhile certainly to be able to access that information ourselves and not need to wait for law enforcement to get it to us. But there's a time factor there. So I envision this person doing more than what the clerk 3 did before, Dave. I think that, she was pretty much hired to answer the phone and, do some miscellaneous things. But as time went on, I think she was doing more, and I think it wasn't working very well, again, because of that gap of time. So, and we did, as Dawn mentioned, we have one of the other part-time ladies worked 32 hours one week and then 24 hours the other week. And I don't know, Dawn, maybe you don't remember the senior, but I think it was maybe late summer. She asked if she could just go to 24 hours a week for both weeks. And so that was approved. So we lost some hours from that part-time person. So I think all in all, I realize that this creates an increase, certainly if they take the benefits. Otherwise, the person retiring was at $20.10 an hour because she was at the top of her step level at step 7. And this new person at a clerk 4, step 1 would be, I believe it's $18.68 and an hour. Yes, that's what it is. And so like Dawn mentioned, there was, with the other part-timer dropping a day every other week, and she likewise, it was at the top of her, she's a clerk 4 and she's at step 7 and her hourly is $21.25. So there's some shifting of money around here. I guess Dawn says about $6,300 from the person just dropping the one day, but we would, and then obviously we would be a little bit of savings on the hourly, but yes, it does increase it. I just think moving forward, I think we should be in a process and a model of having full-time staff. I think it serves our interests much better here, just overall. So then I'll answer any other questions anybody may have.
I'm going to direct a question to Dawn. So was there a review done of the clerk 3 and clerk 4 job description, and is it your recommendation that this be a clerk 4?
Yes, it would be my my recommendation. CJ mentioned that the clerk now is really kind of isolated up front, and with the increased time and being there 5 days a week, The expectation is to cross-train her with the other clerk force, so she would be performing the same duties as the other clerk force. So it would be my recommendation to place the new person in that job classification because of the increased responsibilities.
Okay, thank you.
If I could, Supervisor Baker, I might also add, I'm anticipating one of the other full-time clerk force who's been here, 25 plus years. I believe she's going to be this fall, September, what I'm understanding. So it would be helpful, again, to have, another clerk force that could, whether they move into that spot directly but they would be, we've done with this time off, we've done some other training of the other clerk fours. The transcriptions have been great about learning the judicial and helping us get notifications posted and things like that. So hopefully we won't have this, we won't have so much of a situation where when somebody's gone, then it just sort of dumps the workload on one other person, that all of them would be able to assist. So I do think for the long term, it makes a whole lot more sense to the overall operation of the office.
Okay, thank you, CJ.
You bet.
Okay, any other
My question
questions?
would be my question is about the budget. This is going to be, it has budget ramifications. Is it in your budget to begin July 1st, CJ? Or are we looking, is this going to, we will, I'm sure, have almost an immediate budget amendment anyway, because we're trying to predict what COVID's going to bring us over the next 8 weeks.
Yeah, as you can see, Supervisor McDonough, I didn't think that this would, I marked it down as July 1 for a meeting date, but if it's after that, I think we'll be okay. I would, yes, good question. I probably need to circle back with Stella and just see exactly how much we would need to put back in the budget. But we did increase a couple of things here and there, so it might not be a huge increase overall.
And I'm not questioning that you need this person. That's you're managing the office, and I think great things are happening. But it's dated for July 1st, and it could have a budget implication. So you'll need to work with Stella to get any changes made there. But
sure, absolutely.
I'll make a motion to approve the personnel requisition.
And I will second that.
Motion has been made and seconded. Any further discussion? I did have one question for Dawn or CJ. The hourly pay example that was given, the top of the clerk 3 versus the entry level on clerk 4, was that at the current rate or at the FY21 rate?
That was at this current rate, because we have not negotiated the wage increase for that bargaining unit.
Okay, so that'll be increased by 3%. Is that correct? Or these are not deputy positions, right?
No, that's correct. This
no,
is
these are
courthouse
okay.
unit.
So 3% higher than what we talked about. Okay, I just wanted to get all the information out there, because it's not going to, nobody's going to go into that position until after July 1st. Okay, thank you. All right, any other discussion? All in favor signify by saying aye.
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 Aye, carried 3-0.
Thanks, everybody.
Thank you, CJ. All right, item number 11 on the agenda, tabled and pending items. We have none. Item 12, public comments. At this time, anyone may address the board on matters which are of concern to that person, which are not agenda items. Please go to the podium, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. In this case, it would be raise your hand on Zoom if you're interested in speaking under public comments. And seeing none, we'll move I'm gonna ask for a brief recess till 10 o'clock till we start our COVID-19 meeting.
Motion to recess until 10 o'clock.
And I will second that.
Okay, all in favor signify by saying aye.
Aye.
Convene our work session with the, joint work session with the Dubuque County Board of Health. Item number 1 would be an update from the county emergency response team on COVID-19. And we would defer to Patrice Lambert and Tom Berger.
This is Patrice. Can you hear me?
We can hear you, Patrice.
Okay, good morning on a nice sunny bright day.
Good morning.
My report, good morning. My report will be somewhat brief at the very beginning because we do have some items, as you can see on the agenda, 3 additional items. But I can just share that we're still continuing to encourage people to complete the Test Iowa survey. I see we're a little under, well, I think we're still at 8,000 plus. I was just pulling that up actually to look at it, and I forgot to go further to see what it is. But Linn County is still doing the Test Iowa this week. And again, as we had mentioned last week, that any Dubuque County resident that is eligible for Test Iowa that might possibly go to Linn County, we will still be getting those results for Dubuque County. The results all go to the county that they live in. But we're still encouraging people to complete the survey, and we're still attempting on our end to get Test Iowa site in Dubuque County. So hopefully we'll have more news on that very soon in the future. And also, I just encourage people to go to the new IDPH State Corona. Well, actually, it's not a new site, but it's a new format on their coronavirus site. I know they were still doing some tweaking to that site over the weekend, but hopefully they have it all completed by now. So it is a new format that you will probably need a few minutes just to get comfortable navigating that site. And then again, we ended our testing sites this past week on Friday evening about 5:30, 6 o'clock, looking at the long-term care and our contact tracing. And we did have preliminary numbers, just shy of 1,500. I am confirming those numbers, so by Wednesday we will be able to give you the total count on those numbers. I don't know if Stacy is on the line, Stacy Killian. We have been getting, Stacy, are you on? Okay, we have been getting some reports back, but if you've been following our numbers over the weekend, we haven't had a surge in positives. But we're expecting most of our test results to be coming in today and tomorrow. We are looking at this week of extending the state did grant us to be able to test some additional assisted living sites. So over the weekend, I've been working with a couple of sites, and we'll just see how many test site or collection kits we get, and then we will expand out to our assisted living for this week. And again, we'll probably follow the same format, do the testing Wednesday, Thursday, and Friday, and then hopefully have some preliminary numbers for you on Friday night as well. So that's all that I have for right now, unless there's questions.
Any questions for Patrice?
Patrice, this is Diane Pape Freiberger. On Friday at the Board of Health meeting, after you had stated who had been tested, I asked whether residential facilities that are asking for staff to be tested could also be tested, not utilizing the kits that are supplied by the state, but those that are supplied already that are Unite Clinical Labs was going to give us. Has there been any discussion on that or any plan regarding that?
Yes, there have. These are much easier tests because they're only the anterior nasal, and the sites that we were discussing would have a nurse on site that that could administer those tests. So yes, I have been working with those sites over the weekend, Diane, and nothing's confirmed as of yet.
So residential facilities staff, it's a possibility to test them if you get enough test kits in. Is that correct?
Yes.
Okay, my question is, can we go ahead and utilize those oral pharyngeal, which is basically they have you open your mouth and they touch the back of your throat and get the swab from that. You know, it's not much more complicated. I know what the anterior nasal swab is, and that's pretty easily. But can we also offer them those test kits that that United Clinical Labs has available?
Diane, it's my understanding with those that we would have to look at the supply for the N95s, and I have not gone that deep into conversation with the facilities that I've been in contact over the weekend, so we can talk about this later if you wish.
Thank you. I would like that.
Anything's a possibility. Thanks.
Okay, any other questions for Patrice? Okay,
Patrice, Diane Page Freiberger.
Go ahead, Diane.
This is Diane Page Freiberger. Another question was on Friday, we were going to, as the Board of Health, we were going to receive a list of the facilities that had been tested. Were you waiting to add these ones from this week onto that, or can we receive that, please?
Oh, it makes no difference. I was planning on doing it on Friday, so you would have the full list and I wouldn't have to do it twice, but it makes no difference to me, Diane.
I would like the list of the ones that have currently been already tested, please.
Sure.
Thank you.
Okay, I have a question, Patrice. Dave Baker here. Obviously, it was reported, there was a headline in the Telegraph Herald regarding the Marshallese community experiencing considerable outbreaks. Is there a report from the board, from you as the director of the health department, or perhaps during the Board of Health part of the meeting to get an update on the effects and if there's any mitigation in regard to the Marshallese community?
Dave, we are not supposed to report specifically on special populations. With the contact tracing, we did contact all of those that would have been exposed to a positive. So I'm not comfortable on specifically identifying one population over another. Let me see what I can find and I can present it on Wednesday, Dave.
Patrice, it was a headline in the Telegraph Herald. So I think the cat is out of the bag as far as it being an issue. So I would say I don't think the Telegraph Herald would have put a headline out if it was violating HIPAA to just reference a group of residents. So I don't know where the discomfort would be in providing information on this.
And Dave, if you looked at the sources of the people who were speaking in that report, they were not from the incident command team. But like I said, I will do some checking and I will let you know.
Okay, and are you telling me that the incident command team is not aware of this?
Dave, we contacted, all of our contact tracing would have had a positive exposure to an individual that we had set up our test site down at the Grand River for.
Any other questions for Patrice?
Patrice, Supervisor McDonough, I don't know if you intend to answer these questions as part of the health board, and that's perfectly fine, but I'm wanting to know about the numbers of the contact tracing, what percentage of those individuals actually did come through and finally did get tested, and then also in terms of when we met on Wednesday and the testing was beginning, we thought we'd have those results back within 24 hours, maybe 72. Obviously, those timelines have gone by. So we've been watching the numbers in Dubuque County, the positive cases climb, but there has not been a surge, but also I don't see that there's been a large number of completed testing numbers increase. So are you through with the health board going to break down those numbers so we better understand the numbers of results that have come back from, I'd like to see our testing population, those just under 1,500 tests that we did, had those be broken down to look to see if there's been positives and have all the tests come back. Are we tracking those just to be sure that we have complete data?
Yes, and we are going to be tracking those, and no, they're not. And we have been receiving some over the weekend, but the majority of those have not come in. So yes, we'll need to wait.
So does some mean a couple hundred? Does some mean 20? Does some mean 20%? Can you tell me what to date we have that final from that initial, from 1,500 tests?
Of what I know personally, I know for sure 50 have come in, for sure. And I don't know if Stacy Killian is on. She was planning on being on. She would have more numbers.
She's here. She's muted.
Has not met since Friday evening.
Right. Stacy is here. She's on the phone and muted.
Hold on.
Supervisor Wickham, I'm on that same thing of numbers, if anyone knows, I'm really from a knowledge vantage point. So I would assume all of our tests are going to go to the state's numbers and they'll be reported on the state website. When are those tests reported? When they get the positive, negative, or is that when they hit those numbers, when they actually know the outcome of the test? Does anyone know that number? Okay, so you can basically, for high-level math, you can follow the state every day. They post the number of tests for Dubuque County, and so you can see that the majority of our tests have not been completed, positive or negative, and reported.
Correct. And we did preliminarily a little over 1,400 for those 3 days. So all of those 1,400 will be counted on the website once the results are back, whether they be negative or positive.
But this is Tom Beshan. But at this point, it looks like from the testing, the most we could have had was 20 positives based on where we were on Wednesday and where we are this morning at 197.
Sure, but 20 out of 50 results is a big percentage. So, it's going to be in the details and in the numbers as we break them down.
But Anne, this is Stacy. Can you hear me? Did I to get unmuted? Okay. So I'm working pretty closely with Crescent. Dr. Heather Cruz has been giving me a lot of the positives, and they're working on the negatives. So it may take us a day or so to get those numbers broken down, but we will have those. They're coming in small batches. We're getting small batches of positives and negatives, and they're coming sometimes in the middle of the night, early morning. I just got another batch from her this morning, so it's hard for me to give you a number right at this second because we're trying to get them all straightened out as we switch over to IDPH taking over that contact tracing. But we should, within the next day or so, have a very good amount of numbers to share with all of you.
And also those that were tested on Wednesday would not have been picked up with a courier until 5 p.m. So more than likely, we would not have seen any Wednesday results until Friday. So even with the numbers that Tom Beshan had just shared, if those were since Wednesday, those would not have been included in that amount.
Okay, any other questions?
That's a very good discussion related to, just maybe a comment, a very good discussion related to numbers. And the number I'm really looking at is what is our percent positive, and does that spike up? Because we've been historically below the state average for percent positive of tests. And so I'll keep my fingers crossed that we stay in that category, but my fear is we will move towards a 15 to 20% positive test case rate, if not higher. And then that might guide us to different decisions. But that's what I'm looking at, and I think the conversation is really good related to the numbers and related to percent positive. So I appreciate everybody's thought process on that.
Thank you.
Okay, thank you. Any other questions for Patrice Lambert? Okay, hearing none. Tom Berger?
Hi, Dave and Board of Supervisors. I don't have too much more to add other than we're seeing our request for PPE slow down a bit. So we're also working with some of the other out there that may need the PPE. What we've procured locally, we're able to give to them to assist in their opening, like some of the dentist office that wouldn't have some of the KN95 masks and such. So that's, we did get 2 shipments in from the state last week, and continue working through our EOC and having our outreach meetings with small communities. And we have a fire EMS meeting update for tomorrow night too. So that's kind of where we're at, unless you have any questions.
Any questions for Tom Beschen? Excuse me, Tom Berger? I saw Tom Beschen's name pop up on the screen.
Tom, this is Diane Pape-Freiberger. So a question related back to what Patrice said earlier with the oral pharyngeal tests where they may need some N95s. You actually have them at your location, is that correct? If we needed some of them?
We have a lot of the KN95s with face masks that would be applicable to that, I believe. Try to get some more with the N95s, the actual ones that like the hospitals are using, medical facilities. But there was some paperwork that was sent out to the long-term care facilities last week about that as well, that the other masks would work with in conjunction with the face shield. But we still have a limited supply of the actual N95s. So I guess the short answer is yes, we'd be able to give what we could to them and plus request more from the state.
And just a comment back, so you have contacted those businesses that are opening up that had contributed at the very beginning of this and given you all their PPE and that have requested back to you if you could share some of that. Have you made contact with them, or are you just waiting for them to recontact you?
They would know how to contact me, and most of them have. And what we can give them, is, what we don't. I'm not sure how far down the state is looking at that. The equipment we get from the state has to go to healthcare, fire EMS, but it's expanding now that the supply chain is catching up. So for the most part, the KN95s with the paperwork we provide are providing what the dentists and everybody need.
Thank you.
Mm-hmm.
Other questions for Tom Berger? Okay. Hearing none, we'll...
Hey, Supervisor Baker, I just couldn't get over to the unmute button. This is Ed. Tom Berger, could you mention anything about gowns? Where maybe you did, because I was taking some other notes, but could you say anything about how that's been going in requests and stockpiling from the state?
The gowns are still somewhat slow to get. We're doing better than we were for the healthcare facilities. We've been able to keep up to what the hospitals almost what the hospitals need, as well as long-term care facilities and fire or EMS. But that's about the extent of where we can get the gowns out. So, and I know a lot of the other places are working on their own, and then laundering them. So, trying to anyway. The gowns are still probably, other than the disinfecting wipes, the gowns are probably the harder thing to get yet.
Thank you.
Okay, other questions for Tom Berger? Thank you, Tom. All right, at this point, we'll move to item 2, which is Board of Health update. So I'll virtually turn the gavel over to Chair Tom Beschen.
Thank you, Chair Baker. I would like to start out by indicating that we do have a quorum. Diane Heiken, Diane Pape-Freiberger, Todd Lang, Susie Stroud, and myself. So we have a quorum from the Board of Health. The first item on the agenda is the declaration of disaster emergency. And we spoke about this last week, that in order to provide FEMA funding for the isolation facilities or quarantine facilities, we need to have a declaration of emergency published by the Board of Health and the Emergency Management Group. This has been reviewed by our county legal counsel, and I am prepared to present that to the Board of Health this morning and ask for a motion for approval so we can proceed with this avenue of funding. I guess I'm unsure, Don Sherman, I'm unsure of the process here. Do I read through the entire proclamation?
This was not included in the packet, is that correct?
That is correct.
Okay, so I have been communicating with Auditor Dolan, and there's some concerns of approving this today because it is just considered a work session and it was not included in the packet. So there is discussion and recommendation that you can discuss that today, but we may want to table it and put it in as a separate agenda item for our Wednesday meeting.
Okay.
If I could comment, I believe that this item needs to be on a posted agenda of the Board of Health. It is not an action of the Board of Supervisors. It does not need to be included in a Board of Supervisors agenda.
I understood that the joint meeting with the Board of Health served as a meeting of, or joint meeting between the Board of Supervisors and the Board of Health serves as officially a meeting for both parties. Are you suggesting, Denise, that we have to have a separate meeting of the Board of Health to do this?
I don't know, Tom, that it needs to be a separate meeting, but I think it would be good for the Board of Health to post a separate agenda.
Okay.
I think CJ is on, or possibly we can discuss this with him, or I can discuss it with him after the meeting is over, and we would know what we needed to do for Wednesday. But I guess I would like to see it as a separate agenda so that if someone in the future needs to go back to show to FEMA, or because there's a question, that they would be able to find an agenda of the Board of Health that shows this posting and action, and that it needs to be sent out to the media, et cetera, like we do the notifications for the Board of Supervisors.
Okay.
The
Okay.
notice we're working off today, this Supervisor McDonough, is just for the Dubuque County Board of Supervisors.
Okay, this is listed as a work session, that's correct. So it would have to be okay, can we do that on Wednesday? And I would ask Ed Raber, does that present a problem from a timing standpoint?
No, we can get a separate agenda for the Board of Health with action on this item posted for Wednesday as part of the joint meeting without a problem, but I would just like to see it as a separate posting.
Okay.
CJ just popped up. Are you going to comment here?
Yes, this is CJ. I would definitely agree with Denise, and you'd have plenty of time to get it out there before 24 hours, et cetera. So I think it's
okay. We can do that. We will do that. I guess I still ask the question of Ed Raber. Does Ed Raber see a problem with the timing if this is delayed till Wednesday? Okay.
I believe the proclamation itself says that it is retroactive to January.
That's correct.
So I don't see if doing it today or doing it Wednesday when it's retroactive would make much difference.
Okay. Well, then I guess since we're not in an official board meeting, we do not need a motion to table.
Correct.
Okay. I will bring it back to the meeting on Wednesday, and it will be in your packet. Thank you, Denise. Item B under Board of Health, COVID-19 testing. Diane Pate-Freiberger, we've had a lot of discussion on this already. Is there anything else you want to address as a part of this discussion?
Yes, I would, Tom. We have been in conversation extensively with United Clinical Labs. Actually, we had come to an agreement with United Clinical Labs, and CJ suggested to Ed Raber that we come up with an MOU, which is a Memorandum of Understanding with United Clinical Labs for acquiring and for getting the process in which the tests would be administered and the test results would be brought back to us. And with United Clinical Labs, again, like I've had discussion with Patrice earlier, that the collection kits that United Clinical Labs has and what Mayo Clinic would send back as replacements are actually the oral pharyngeal and not just the anterior nasal swabs, which actually scientifically, you want to get to the back of the throat if you can. So it's not going to demonstrate less of an accuracy. Actually, it would be just as good, if maybe not better, to do the oral pharyngeal. And so, so we had come to an agreement, verbal agreement, email agreement with Dr. Vanderheiden and with United Clinical Lab director. But then on Friday, May 8th, when Supervisor Jay Wickham sent an email to the full Board of Health and Patrice with suggestions for testing 10,000 people by July 1st, prior to discussing this with the committee, our committee from the Board of Health, Dr. Bobby Canero went ahead and approached the director of United Clinical Labs to talk to them about it, to see if Mayo Clinic could handle this volume of testing. So immediately on Friday, the director went ahead, emailed the director up at Mayo Clinic, and she's also asking from LabCorp whether they could handle this volume also. And we are waiting for a response. She was going to call them today if she had not gotten an email back. And both LabCorp and Mayo Clinic charge the same amount, $147 per test. So at this time, Bobby wanted to wait until we heard back from United Clinical Lab to make sure they could handle this volume. So tomorrow night, Tuesday, we are having a meeting with the committee, the Board of Health Committee for Testing, with some members of the Incident Command Team and with some members of the testing, the DCHCPC Community Test Site Planning members. And our goal is tomorrow night on Tuesday, in our discussion, by the end of it, we will have the concrete plan to hand back to United Clinical Labs for acquiring the tests. We will be able to tell how many days per week, how many tests per day that we would like taken. The tests that we're talking about are not specifically for some of these targeted sites, even though we may include targeted sites. Like if the residential facilities do not get their testing done this week, they would be included with targeted testing. But the big goal, the major goal of this is so that community members who currently cannot get tested will be able to get tested. And in the future, we are not talking about the serology antibody test at this point. We do want to include that in the future, but Dr. Canero agreed with me, and I believe Diane Heiken did too, that would be down the road. It's not for right now, but that we will need that upon opening up. But right now, we need to test for the active virus in our community. Any questions?
This is Todd, and I have a question. Thanks for that update, Diane.
Yes, Todd. Did you have a question, Todd?
Yeah.
Supervisor Ann McDonough, while we wait for Todd to rejoin us, he's here under Carolyn's name. There's not been, the 10,000 test kits. That we would need to look at that with some kind of purpose-driven request, that fulfills how come 10,000? What are we intending to do with that? I mean, we need to put together something that is purpose. We can have some discussion about that, certainly. The cost for 10,000 citizens to be tested, is that warranted? I think we need to have some communication and some thought process about this with, that's more people than I understand have even gone on to the Test Iowa website to put in their information. So the testing committee through the incident team has not recommended this as far as I know. So I just want to be sure that when we are proceeding with some public testing, we know, I guess at the end of the day, I don't want to buy 10,000 test kits tomorrow. So I would like to have us have some room for discussion. That's not been part of the discussion. And then also be looking at this in terms of using those test kits last as compared to any test kits that become available through Crescent or through Test Iowa. Make sure that we're not committing ourselves to something that we don't have full purpose for.
And Supervisor McDonough, I agree with that we need to have more discussion on that. And that's why last week we were ready to move ahead with starting with the 200 collection kits that United Clinical Lab was going to supply us, and then replace that with 200 from Mayo Clinic and continue that process as we identify the need. And that's very important that we need to include Crescent in these conversations. And Gary Collins, I sent an email to him and requested him to be part of this conversation tomorrow night also, because from my understanding, they are a valuable member of this whole committee and everyone needs to be included also. Did I answer your question, Ann, or statement?
Yes.
Okay.
Okay, Diane, this is Tom. I'm trying to get Todd unmuted. Todd is, whoop, hold on.
Tom, if Todd could send us a question through chat, would that work?
I see Chris Kirsch is here, and I'm just wondering if she could address, and maybe she's not comfortable with this, and that's fine, but kind of kicking this down the road maybe to Wednesday, we have, I believe, tested the staff at Sunnycrest, and we were not able to test the residents of Sunnycrest. Wondering if that's something that she wishes we could do, and maybe folks can address that. Sunnycrest just happens to be near to me because they are our own employees and our own facility.
Good morning, everybody.
Hello, Chris.
So since last Tuesday, we have tested 163 of our staff members. At this moment of time, we have 136 tests returned to us, which have not detected. Since we do testing of our residents based on symptoms, so they are put in isolation once they have the symptoms of a temp or a cough or anything out of the ordinary for them above their baseline. And then they're put in isolation. We test them per doctor's orders, and then we wait. Usually it's 2 to 3 days. All of our residents' tests have been negative. We do, however, keep the resident in isolation until their symptoms for which they went into isolation subside. So I'm not sure about testing, purchasing 10,000 kits. I'm not sure what population would need to be tested. The long-term care workers being tested. Was a grand idea. Although very exhausting for us, it was a grand idea because we would have been the asymptomatic group that could have been giving them to our population of the most vulnerable.
Chris, this is Diane Heiken, and I'm sorry, could you repeat the numbers that you made at the beginning of your statement, please?
What, how many we tested?
Yes, I think you said 136 were negative, but how many have you tested?
We tested 163.
And that's including residents and staff, or just staff?
We did not test residents. We only test residents if they show symptoms.
Right, so are they included in that 163 or not?
No.
Okay, that was just staff. Thank you.
And Chris, are you waiting for another 27? There should be another 27. Are you just waiting to hear back whether they're positive or negative, or?
They've been coming in by fax machine
okay.
Since we started testing on Tuesday night, and we ended our testing here on Thursday. So we've been having test results trickle in by fax. I'd say the test results started to trickle in on Thursday. You know, 5 here, 17 there, 20 here.
It's interesting to me, Supervisor McDonough, that you have 132 results back, but I understood Patrice to say that she was only aware of 50 results back.
Well, that's from my testing site, Ann.
wasn't your testing site part of this group of 1,500 tests?
As I understand it I spoke to the Iowa Department of Public Health, and they have no communication between the two. I have to communicate these test results to the Iowa Department of Public Health.
Okay, I still don't understand. Patrice, are you still here?
Patrice might not be aware of my test results.
And this is Patrice, and we had to have a medical director from each of the facilities sign off because we still needed to have a physician's signature or a physician's order to have those done. So right now, all of the agencies or the long-term care agencies that tested last week will be getting their results to that medical director. Then Stacy and the communicable disease nurses will have contact with those medical directors with the positives, the negatives, the total number, which will take us probably until the end of the week to get all of that information. But because it's a physician order, all of those results, negative, positive, go to the medical director first. And we did have to have a fax number, so if Chris had put down her fax number, then for her medical director, it went to that fax. But we will, Stacy would have been contacted with all of the positives, but not the negatives. So, and I do need to stress too that all of the testing that we did last week and that we're hoping to get completed this week are all free of charge for the testing kits and the collection kits as well as the testing process. The Instant Command Team has a wonderful working relationship right now with IDPH that they saw what we did last week, that we were able to facilitate this. So that's why they're letting us expand to additional facilities this week. And I am hoping that if this goes successful as well, I'm hoping that our conversations will continue. Because even though IDPH informed us who they felt that we should, well, not even felt, they gave us the directive of who we should be testing, we see a partnership that maybe we could continue this, but again, it would be with their directive. I'm guessing it'll probably continue with the essential workers, healthcare providers, whatever. But we don't even know if they'll allow us to have this plan continue after this week. But please know that those conversations are continuing because, again, we're not having to pay the $147 for the collection kit, but we may have to, in some situations, see that we have to utilize a nurse if a facility doesn't have a nurse available. But again, even within our Instant Command Team, we are looking at options that can be done. So please know that the Instant Command Team is still working on expanding the kits that are free of charge.
Thank you for that. The new information for me about the testing is that the results from LabCorp are coming back. They just are not all back to Patrice and to the Incident Command Team, to the Board of Health, in a way that can be reported out. But we are getting prompt results. They're just going to the facilities and to their medical directors. Is that assumption correct? Yes, okay. So that's working, and because I think there was a delay over the weekend and people were wondering, you know, how did our test get all caught up? And what's the bottleneck? And it sounds like it's working the way it does. It just isn't being reported out to us the way we had expected it to.
Correct, but the positives would be showing up on the website, on the map.
And so we know that the positives that have come in, even from our own testing sites, they are being reported on IDPH's website. So the additional positives we've seen over the weekend, they may be from our testing.
Correct. Or they may be from private healthcare providers as well. But yeah, they will be posted.
Right. But will we ultimately know from our testing, you will issue some final report to us that shows from our 1,500 person testing what the results were?
Yes. And we're curious with the percentage as well, Ann. Yes.
Okay. Because that is a model for lots of things. I agree with you about that. Relationships, results, all those things are good modeling.
Patrice, this is Diane Hyken. Thank you for continuing the conversations about doing more testing. I think that will be valuable. But I wanted to clarify, first of all, you'll be at our meeting tomorrow night as well as Stacy, is that correct?
Yes.
Okay. And secondly, I think last Wednesday a question had come up and you were not available. You were at the testing site, and I wanted to address that now. Supervisor Wickham had asked about the option for us to use the information from the Test Iowa assessments to find out who was maybe eligible in Dubuque County and to incorporate them into doing our testing. But I believe you had checked into that, and did they say that we cannot access that information at this time?
Correct. When I talked with the governor's office and IDPH last week, I did ask if we could bring in the people who had completed, from Dubuque County, the people that had completed the Test Iowa survey, because maybe they, if they were eligible, maybe some of the barriers that they were experiencing was transportation to Des Moines or Blackhawk. And I was told no, we could not bring those people in. And again, they gave us the directive to do our contact tracing and the long-term care. But again, those testing kits and the process for the testing was completely free of charge by following their directive. But no, they told me we could not bring in the Test Iowa.
And I'm just wondering if you see an opportunity to bring that up since you're having these continuing conversations.
Absolutely. Yep, that will not be off the table. Trust me, Diane.
Okay, because things are changing daily, so I think it's good to just keep asking the questions. So thank you.
Absolutely.
Patrice Ann McDonough with another question. Representative Lindsay James posted on Facebook over probably the last 3 or 4 days apparently an email that someone received from Test Iowa, and the conclusion was that Test Iowa is actively discouraging testing. And I'd like to have you address that, whether you believe that Test Iowa is actively discouraging people from being tested.
And I can't discuss that because I don't have any information on that. If you could send me what Lindsay James had sent you, I can look into it, but no, I have no knowledge whatsoever of that.
I will send it to you. It's not something she sent to me. It's something that she posted on Facebook. And, there's been many, many comments about that and many sharings about that, indicating that Test Iowa is discouraging testing. That's not anything that I have heard from people who've actually completed the Test Iowa and been recommended for testing.
Nor have I, Ann.
Patrice, this is
I think it brings up this is Supervisor Wickham, if I could jump in. I think it brings up a good point. I'm very pleased with the partnership that we've gotten with the state. If 1,000 is what we can get, 1,000 is what we'll take. But I think it brings up a point that between the Board of Health, the incident management team, the city, all the other partners we have, if the Board of Health can continue to focus locally on what we can do, empower ourselves. As I've quoted before, if we're waiting for Des Moines or Washington, D.C. to take care of our citizens, that's you'll be waiting for a while. So I'm really encouraged by the proactive approach we've taken related to testing and related to any and all partnerships we can get. But at the end of the day, it's up to this group to do everything we can to ensure the safety and the best of our ability during this pandemic. And so thank you for everyone's effort, and I think we're making really good progress, and I just encourage you to keep moving.
Patrice, this is Diane Pate-Freiberger. This requisition for testing for this week, was there a number, did I miss that? Was there a number of collection kits that you requested for this week or that the state's going to provide?
No, they're going to let us know this afternoon, Diane. But we're still doing all of our preliminary work.
Okay, thank you. And I appreciate all this effort. In addition, what the other members of the committee for testing with the Board of Health are recommending is that individuals who do not meet the state criteria can also be tested. And I think that that's where the recommendations to utilize some county funds that have been appropriated to get those individuals tested also.
Okay.
Did we ever hear from Todd? He had a question.
Well, I have muted him multiple times, but well, wait a minute. Okay, yes, Todd is unmuted now.
Can you hear me?
Yes.
Okay. I apologize. I'm using a different computer. I've been having technical issues this morning. I just kind of had a general question throughout our discussion with regard to testing. You know, my understanding is we've had 1,500 tests conducted at the end of the week. I was just wondering if we know roughly a percentage of how many of those were long-term facility staff or residents versus like contact tracing, or how that stacks up compared to the total number of long-term care staff and residents in the county. You know, I'm just trying to gauge personally, like how much progress we're kind of making in that area.
I would have to refer that to Stacy or Patrice. Patrice or Stacy, can you answer Todd's question?
I also had another quick comment, and I think I made this Friday, is just looking at the three kind of potential hotspots, if you will: long-term care facilities, meat processing plants, which we don't have in Dubuque County, and then prisons and jails. And as far as I know, there hasn't been any testing done in the jail. And do we have a sense? There was a call last week, and Mike Menster, the jail administrator, said there wasn't any testing done. Have we gotten any feedback from anybody in the jail, the community, that that's a concern? Because we see that throughout the country. And I just wanted to put that out there, you know, if that has been raised as a potential concern in the community.
And this is Patrice. I couldn't get unmuted, so I apologize. So thanks, Don, for helping. Can you hear me? I'm sorry.
Yes.
Yes. Okay. I couldn't get unmuted. Todd, yes, that discussion has occurred with the incident command team with the jail component. So just know discussions are going on with that. And with your other question, as soon as we get our final numbers, a report will be coming out. You had asked regarding the contact tracing and the long-term care.
Thanks,
Patrice. This is Diane Heiken. So I had seen a number over the weekend put out. Todd, are you asking? You're not asking for the results. You're asking for the breakdown of the numbers, correct?
Yeah, just the numbers in general to figure out kind of like our penetration rate, if you will.
So sure. Patrice, I have seen numbers over the weekend.
We have the preliminary, and I've been working with all of the long-term care administrators over the weekend to get the final numbers. I had asked them to respond to me by noon today, so I do not have those as of yet.
Is it anywhere near these numbers, Patrice? 1,134 staff from long-term care facilities and approximately 322 identified through contact tracing?
Our total count was, I believe, 1,456 for both groups. So I don't want to comment, Diane, because I don't want to say one number and find out at noon that it's a completely different one.
Okay. Yeah, Todd, that's just what I had seen reported over the weekend, to give you an idea.
And Diane, where did you see that reported?
I got an email from the Dubuque County Public Health COVID-19 update.
Okay, got it, through the report. Okay.
Because so I mean, it gives them an idea of, it was more of the staff from long-term care facilities, if that's what you're wondering, Todd.
Yes, that's true. But I just don't have the final numbers. I'd rather wait until I get those, and then I'll share those.
Yep, I understand.
Okay, Tom Beschen here. If that's the discussion on COVID-19 testing, the third item on the Board of Health, or the work session is isolation shelter sites, and I didn't have that on there. I don't know who's planning to address that.
This is Ed Raber, and actually I had asked for that to be on the Board of Supervisors agenda, and I'll ask for it to be on the Supervisors agenda again for Wednesday. I can give a brief update on that. I've had an opportunity to speak with city leaders at the end of last week about the isolation shelter that they have arranged and put together. I think they've noted that they have a primary one that they're using now, that they've outfitted for residential style living, and they have some backup secondary facilities that they are not using right now. What I'm suggesting is that even beginning as early as later today after these meetings, that we re-engage the city in some discussions around that isolation shelter to figure out how the city and the county may collaborate or what arrangement may be the best one. And I'd like to see that happen as soon as possible. I don't know how often this happens, but it would be nice if I could, in addition to perhaps my staff colleagues like Dawn Sherman, if there may be a supervisor that wanted to be a part of those discussions, I would welcome that, try to arrange around that.
And what discussions are you talking about that you want a supervisor to be engaged in?
I'm just open to that. The way the city has submitted, has put out, just at the end of the day on Friday, put out a request for proposals for staffing that facility, that they'd like responses back on Monday the 18th. There's probably some other additional moving parts there that I think the city leaders that I spoke with, staff leaders that I spoke with, were interested in re-engaging the county to see potentially what sort of partnership they may have there. So I'm going to do that. I'm just offering that if there's a particular supervisor that's interested in that, I would try to keep them engaged through that. So there'll probably be a few conversations about that. So that doesn't have to be initially, but I'm hoping that that we can come back and shortly have something to present from those additional conversations.
Has the city reached out to you? They have not reached out to me.
Yes, after last Wednesday, the supervisors meeting, there were some questions about the shelter. So I had been the one to reach out to, as a follow-up to Alexis Stager, the housing director, and we've talked. That also resulted in then city manager Mike Van Milligan and I having a conversation, and I would like to continue exploring those conversations and see where that is and what opportunity there is for the county. Does anyone have any questions about that?
No questions, Ed. This is just Supervisor Wickham. Certainly appreciate you extending that collaboration to the city as a partner, and I'm very pleased that the city has pushed forward and opened this up. But I would ask you maybe to collaborate with the Board of Health to make sure that they're in the loop, and or if there's members of the Board of Health as a chair, that they be involved.
Sure. That's all I have at this time.
Okay. All right. Then Supervisor Baker, I'll turn it back to you.
Okay, thank you, Chair Beshen. I believe we did kind of wander into item 3 there. So are there any other issues, discussion related to the COVID-19 issue that hasn't been discussed yet today? All right, hearing none. We do have a noon work session. So at this point, I would recommend a motion to recess for about 1 hour, reconvening at 12 o'clock p.m.
Motion to recess until 12 o'clock noon.
And I will second that.
Okay, any discussion? All in favor signify by saying aye.
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 Aye. We are in recess till noon.